We are talking about sustainability, however there are some hiccups in this whole field of surgery. Because you have to consider that all the instruments have to be tracked and traced. Every patient who is operated with a certain instrument, we want to know which instrument was used, and we call that track and trace. So for example, after an operation, it will be shown that there is something wrong, then we want to know which instrument was used in this patient. For example, not for the bacteria, because they will be sterilized, but for the prion, it's important to know which instrument is used. So every instrument has to be in a tray, and we want to know which instruments are used in this separate operation. So that's one hiccup. The second hiccup is actually if I do a minimally invasive operation, but I have to convert to an open procedure, that means that I cannot use these instruments anymore. So, for example, the scrub nurse opens this because I'm going to do minimally invasive surgery, but I decided to make a bigger scar and I use my conventional instruments. This cannot be used, although it's not used in the patient yet, again to another patient. So that's another hiccup. We have to be aware that surgery can be in an acute phase. So we always have to be aware that we have a set available, sterile, because whenever an emergency comes in, that means that we do an operation at a very urgent moment, that we have this set available or this set available. The fourth thing is that you have to be aware that all these instruments available here, we don't use them during the whole operation. For example, sometimes you have an operation where you use the scissors very oftenly. But on the other hand, you have sometimes operations where you use these scissors only once, just to cut a thread. Imagine that you are using a disposable instrument only to cut a thread is not penny-wise. The fifth problem is working with biomaterials or new materials. For example, the hip replacement. New hips will brought in the prosthesis, and the surgeon has to work with the prosthesis but also with new instruments to adapt it into the human being. And that means that he's not accustomed to work with all these instruments which are brought by the industry, so he wants to open his own instruments as well. And the other thing is that they do not know exactly which instrument is in which package, for example. So they open several packages to look where this specific instrument is. The sixth problem is that you sometimes need an instrument which is packed in the tray. So you have to open a whole tray just for one instrument.